Hello.
Hello.
Good afternoon. My name is Elvira Ferreira, and I am here today to talk to you about a SCFE, what it is, and how to remember what it is, with a fun way, which is the power of the S. A SCFE is an acronym for Slit Capital Femoral Epiphysis. Almost every detail in this informative speech will help you associate the symptoms, the cause, and the diagnosis and the treatment with the letter with which it starts, S. Why is it important, you might ask? Well, it was a family member that helped me diagnose my son, and maybe you can help someone you know if it ever happens, God forbid. A SCFE is when the femoral bone begins to slip off the pelvic bone. A doctor explained it to me as ice cream slipping off the cone, as you can see here. The symptoms of a SCFE can be hard to determine, and in some cases, the pain is often sudden and onset. What that means is that it's in the hip, thigh, the groin area, and it can occasionally cause pain in the knee as well. I say it can be hard to determine because the pain is immediate, but the symptoms develop over time as the slippage progresses. For instance, my son's SCFE went unnoticed for quite a while. He fell off his hoverboard, and we assumed that the pain he was having was due to that. He developed a limp for about a good month on his right leg, and then after a while, he started limping on the other side. Well, one morning, he got up to get ready for school, and he couldn't get out of bed. He cried from the pain. This was about 2 months after the fall. So I made an appointment that afternoon for the pediatrician, and they told us it was a sprained, strained groin muscle. They prescribed him a pain medicine, told us to alternate ice and heat, and to stretch it, and to come back in a week. About a week and a half, we took him back, and he was feeling better. The limp was gone. But about 2 weeks, I want to say, he started limping again. Rather than going back to the pediatrician, we tried what we did the first time. Alternating ice and heat, stretching, pain medication, but we added no strenuous activities. But for an active adolescent, that was difficult. But that brings me to my second point. Who does it affect? Mostly obese adolescent boys ages 12 to 15. My son was only 11 and might have been slightly obese, but he managed to get a SCFE. In most cases, a SCFE only affects one hip, but my son is so lucky he got a double SCFE. More on that later. It normally happens in boys, but girls can get it too. One of the cases, or what, no one knows why it happens, but those are two main factors. A third main factor would be genetics or family history. It can be hereditary or passed down through genes. You see, it turns out my son's dad and his cousin had SCFEs when they were younger. It was my son's uncle who remembered their son had the same limping problem and told me to have my son's growth plate checked. So that's what we did. So commences the diagnosis portion of this speech. One Friday, we went to the pediatrician for the third time over the last 5 months, and the doctor finally agreed to give us a referral for x-ray. That's step 2. Step 1 was checking his limited range of motion and the pain it caused, and that was done at previous appointment. No improvements were made. Come Monday, we took the x-rays. They ordered a frog view, and that extends the hip and gives a flex open view, and that gives a perfect view to the hip and the bone, or the hip and the thigh bone. Once they were done, we went home, but that's not normally how it plays out. Because we were a referral and not a doctor's office, we had to go home and wait till those x-rays were reviewed. Tuesday afternoon, I got an urgent call from the nurse saying that my son needed to go to the emergency room and inform them that my son had a SCFE, which at this point, I was much like you and had no idea what that even was. I was also informed that I should not let my son walk because he was not able to bear weight on his hips. We were going to need a wheelchair. As a frantic mom, I called my husband, I called my son's dad, and I let them know the situation and the severity of it. Once we were at Children's Emergency, the doctors reviewed the x-ray, and they reviewed the x-ray and let us know that any plans we had for Thanksgiving needed to be canceled. The reason a SCFE is considered an emergency is because what happens to the bone. In the process of avascular necrosis, the blood flow cuts off and the bone starts to die. That means no more leg growth. What's even scarier is that avascular necrosis has no symptoms, but it can have pain. But that could be attributed to a number of other things, much like my son had. I'm thankful we made it to the hospital in time and no damage like that was done. My doctor decided that we should do an emergency surgery, but since my son had eaten within the last 12 hours, we had to wait till morning. It all happened so quickly, but the surgery took forever. Yes, I said surgery. Surgery is the treatment for a SCFE. Technically, surgical pinning. What happens during surgical pinning is the patient is put under anesthesia and numbed. The doctor makes a small incision in the upper thigh of the SCFE leg. In my son, it was both legs. The doctor then proceeds to fit a screw through a guided wire, you can see here, into the growth plate to keep the femoral head from slipping out of the growth plate. My son was in surgery for about 3.5 hours, 1 hour per leg, and about 45 minutes for prep and 45 minutes for recovery. The average surgery depends on the type of SCFE there is. There are 2 types of SCFEs, stable and unstable. My son had a stable SCFE in both hips, but in an unstable SCFE, they had to go in and reset the head of the femoral bone into the hip socket. It's almost like popping a bone back into place. That can be painful. Then once that's done, it's been reset, they can continue with the surgical pinning. Needless to say, all went well, but we did have to stay overnight into Thanksgiving morning. Come Thanksgiving morning, the doctors came in and to let us be released, and they sent us home with pain meds, a wheelchair, and 6 weeks of confinement to that wheelchair. Yes, I said 6 weeks. 6 weeks is the recovery time required for surgical pinning. With an overactive adolescent, it was by God's grace we made it through. While this was a personal experience, I hope that you guys leave with some kind of remembrance of what a slip capital femoral epiphysis is. Remember, this is my son's incision site. This was him during, before, after, and Thanksgiving morning before we got to go home. And the reason that the way that you can remember what the SCFE is, what I want you to go home with is the power of the S. The possible causes are obese 12 to 15-year-olds. It's passed on through genes. Symptoms are sudden or onset. Diagnosis would be the X-ray in a frog leg formation, which is flexed and open to best view the growth plate and slippage. The types there are stable and unstable. And the treatment would be surgery or surgical pinning, or to reset and then pin, depending on the type. And then the recovery for the surgery is going to be about 6 weeks. While I know that seems like a lot of information, I hope that with this fun way, you guys will remember what it is to have a SCFE. I'd also like to give a special thanks to the site pages that I used, which was OrthoInfo, and that was with the slip capital femoral epiphysis, and for the picture and the information that was not based off of my own personal information. If you have any other questions, please feel free to look up SCFE or reach out to me. I would love to help you with this personal matter. Thank you.